Hi, it's Christina Wang, and on behalf of the American Society of Retina Specialists, I am here in Stockholm, Sweden for ASRS 2024. It's my great pleasure to be joined here today by Dr. Michael Yu, who is a second-year surgical retina fellow at the Wills Eye Hospital, Mid-Atlantic Retina. Dr. Yu is here presenting his poster looking at optical density of subretinal fluid and how that correlates with retinal detachment chronicity. Michael, first of all, big congratulations. You are this year's first place winner of the ASRS Poster Award, selected out of over 200 fabulous submissions. And to the viewer, if Michael's name sounds familiar, it's because you placed in the top 10 just a couple of years ago as a resident. So double kudos to you. Thanks for joining us today.
Oh, thanks so much for having me. And on behalf of the entire research team, thank you once again. It's such a privilege to win this award. And we recognize that there's so much amazing research at ASRS, so definitely an honor.
It's very, very much well-deserved. So, Michael, I want to talk about the work that you've done here because it's interesting. We know that time to intervention is a major driver in patient outcomes for retinal detachment repair. And yet it's interesting how much we rely on patients' recollection of symptoms to estimate how long they've been detached. Your work looks at how we might be able to use OCT as a biomarker to more objectively determine a retinal detachment's chronicity, which is, I think, fascinating. Why don't we take a step back, though? Start from the beginning here. Why is it important to know how long a retina has been detached, or at least a good estimate from a clinical standpoint?
Yeah, absolutely. So we know that the duration that a fovea has been detached correlates with postoperative visual acuity. And the longer that a fovea has been detached, the worse the postoperative visual acuity is. And exactly like you mentioned, the most interesting thing about this is we're basing our surgical decision-making purely off of subjective reports from the patient. We've all been there. We've had patients that are MAC off, and they say their vision is completely fine. And we also have patients that have very chronic detachments, and they say that symptoms have been there for only a day or two. And so what we wanted to do with this research is find more objective, reproducible ways of ascertaining how long a detachment's been there for.
So tell us about the study and what did you find?
Well, I'll back up a little bit and I'll say that this was inspired by Rajiv Muni's group. They did some really interesting research looking at OCT biomarkers for retinal detachment chronicity. They looked at photoreceptor morphology and basically described the sequence that photoreceptors change over time with detachment. And we want to do something very similar. So we knew that total protein concentration within subretinal fluid and retinal attachment, it tends to increase over time. The question is, can we see it on OCT? And if so, can we correlate that to symptom chronicity as well? And so that's kind of the genesis of this research. And to do it, we looked at 72 cases of MAC-off RDs. We focused on OCTs, specifically spectral domain OCTs. And what we did with these MAC-off RDs is we took the OCT, we imported it into ImageJ, and we looked at the optical density. We basically selected a region of interest within the subretinal space and also within the vitreous space. And we got the optical densities of the subretinal fluid and of the vitreous, and we took the ratio between the two to give us the optical density ratio. And then we matched it up with patient-reported symptoms. That was the first part of the analysis. The second part of the analysis was actually going back to Dr. Muni's paper and looking at the photoreceptor staging based on their criteria. So we staged these as 1, 2, 3, 4, or 5, and that gave us a sense of whether or not this is a subacute, acute, or a chronic retinal attachment. We can see that on the scatter plot, at least, there's a very strong correlation between patient-reported symptoms, symptom duration, and the optical density ratio. We got an R-squared of 0.564, very strong correlation there. But that correlation actually strengthened when we stratified everything based on chronicity, based on photoreceptor staging. So kind of goes to your point, which is that patients aren't the most accurate at reporting their symptoms.
That's really fascinating. Thanks for that summary. What is next? I mean, is your group potentially going to take maybe the optical density ratios and look to see how they correlate with surgical outcomes? Is that a next step?
That's exactly it. So the big question that we have to answer at this point is, outside of our center, is this reproducible? So we need larger validation studies. But to your second point, which is outcomes, it'd be nice to correlate these findings to visual acuity.
Absolutely. Well, absolutely phenomenal work that you and your research group have done. And to our members, please remember to check out Michael's poster, but also all of the other fabulous posters in the exhibit hall or on your meeting app. Congratulations to you and your entire research group, Michael. Very well deserved, and we appreciate the chance to chat with you today.
Yep. Thanks so much for having me.
And this is Christina Wang reporting for ASRS Updates from the Field.